So I think we'll go on to the next study with Dr. Sirisha will talk about the role of clear lens extraction and MIGS, a combined surgery, I guess.
I think this is a combination of many things.
Yeah.
While she's waiting for her slides, is there anybody who'd like a... Are your slides there, Sirisha?
Just want to add that we usually don't get...
Yeah.
Okay.
Okay. So it will be interesting to see where the clear lens extraction stands and what is the role of MIGS in angle closure. I just showed this slide. In angle closure, I think it's not one single mechanism. We all will agree that there is a complex interplay of anatomic abnormalities, including the pupillary block, the anatomic abnormality of the ciliary body and the iris placement with the ciliary processes being anteriorly placed of the plateau iris and excess ICL, the lens vault. So while LPI relieves the pupillary block, we know that the other mechanisms of the underlying anatomic abnormality may continue to be present, and sometimes the angle closure may progress. So this is something that we need to remember, and this is where you possibly come to lens extraction, whether it can help decrease the angle closure. Yes, lens extraction definitely relieves the posterior forces crowding the angle, and thereby can help to open up the angle to a great extent. Before moving to the clear lens, I thought I will just take you through the effect of phacoemulsification on intraocular pressure in glaucoma patients, as was published as an OTA series. So in this, the intraocular pressure after cataract surgery in POAG, PACG and pseudoexfoliation, if you see, there is significant reduction in IOP both in PACG and acute angle closure. And the maximum was in acute angle closure, and none of the patients actually required any anti-glaucoma medications in the follow-up. Does clear lens extraction really help? In 2011, we didn't have evidence, as was written then by Ravi Thomas. And in 2015, Dr. Tanudasa's group had shown that clear lens extraction in eyes with primary angle closure with high intraocular pressure was more than 25 millimeters of mercury for at least 8 weeks post LPI and on medications were enrolled into this study. And at the end of 1 year, they found that 86% of these eyes did not require any anti-glaucoma medication. So you remember, this is a very specified cohort here. An EAGLE study, just now Ankur also spoke about it, just to brief about where we stand. So clear lens extraction, although I would agree with Dr. Shanta, were they really clear lenses, we do not know. But according to them, clear lens extraction versus the standard of care, which was LPI and anti-glaucoma medications in PAC and PACG. Those patients who all of them were over 50 years of age and had intraocular pressure more than 30 and or PACG with a mean deviation better than 15 decibels, and they were randomized to either LPI or a clear lens extraction. So this is a forest plot that looked at the quality of life as well as the intraocular pressure control, both of which favor the clear lens extraction group. However, you need to remember that there was a huge list of complications that were there with any intervention, and of course, in angle closure eyes, you also have to worry about the posterior high pressure, the corneal endothelial problem, and malignant glaucoma that you may deal with, and how many of these patients will continue to, will go on to develop these intraocular problems even later during the postoperative period is something that we need to remember. So to summarize, lens extraction definitely deepens the anterior chamber, helps to relieve the pupillary block, opens up the angle, and possibly increases the trabecular filtration if the trabecular meshwork is functioning well. So to summarize, you will not do a clear lens extraction unless you have an acute angle closure with high IOP or a post-LPI PAC with either a clear lens or minimal cataract with an elevated intraocular pressure. Definitely lens extraction is helpful, or in those patients with a very high lens vault and occludable angle post-PI. So do MIGS have a role to play? All we know about MIGS, in fact, there's been a lot of talk about MIGS in the past few days in our meeting as well. So typically MIGS are something that we use, the angle-based procedures are something that we use for open angle glaucoma. But if the angle is closed, or if you don't have an approach to visualizing the angle, if there is not much enough space, how do you even go ahead and do an angle-based procedure? So access becomes difficult in these eyes, but If suppose you are able to open up the angle by doing a cataract extraction, you may want to combine it with an angle-based procedure. However, one has to remember, even if the angle is open in these patients, how well is the trabecular meshwork functioning? How is the Schlemm's canal complex in these patients? And if many times you see that goniosynoculosis is something that is combined with either a cataract extraction alone or one of the mixed procedures, do they really help in reducing the intraocular pressure? So these are something that we need to remember. There are various mixed procedures that are available, whether it is ablating the angle structures or trying to incise them, trying to excise them. There are several procedures that are there that we discuss about. All of these, in my opinion, have some role to play if you're combining it with a cataract surgery, or it is angle closure eye that was, cataract was operated, is pseudophakic now has uncontrolled pressures, and you have additional indications for you to decide on whether you want to do an angle-based procedure or not. You can combine it, but as a standalone, obviously, it doesn't have much role to play. And if you see the several studies that are published, many of them are retrospective studies, but all of them, except maybe one or two, have included phacoemulsification along with doing one of those mixed procedures. So do we have a conclusion, and where is the present evidence, and what is the lack of evidence rather? So mix and angle closure, at least the present evidence says that it shows promise